I am from the Bronx, New York, South Bronx, East 179th Street, and Tremont Avenue, Lambert houses. I grew up in a single-parent household with my mother, and my mother suffered a lot from depression. My father wasn't there for the most part because of drugs have taken over his life. I didn't think that God loved this little black girl that was growing up in the hood. I thought that because I, what I look like, where I come from, the way I talk, the way I walk, my hair, my nose, my complexion, everything about me was a curse. What inspired me, I watched my mother attempt to commit suicide when I was 11 years old. And I still see the image in my head. The cops came, the paramedics came, and what was disheartening was how the paramedics spoke of my mother. And I never told my mother this, but one of the things I overheard the paramedics said, here we go, another crackhead again. Mind you, my mother was not a crackhead. She did certain things in her life to be able to deal with her pain, but she wasn't a crackhead. And that in itself sparked that inspiration, that motivation for me to want to become a doctor. Oftentimes, and even to this day, a lot of physicians don't have cultural sensitivity. The Latin American School of Medicine of Havana, Cuba. Just for people to understand, the medical school curriculum, all the classes, all the subjects are taught in Spanish. Your exams are in Spanish. So you're speaking Spanish 24 hours a day. And everybody asks me, how in the hell did you learn how to speak Spanish? I always say, when you're hungry for something, you're gonna do what you gotta do, right? You're not gonna let anything stop you. I speak Spanish, I want to say about 90% of the time at my job. Óyeme, ya tú no sabes, niña, ¿qué voy a hacer, Ya tú sabes, esa cubanita ahí. I mean, it's a Cuban saying. It's like a joke. It's like a way of saying, like, you don't know about this little Cuban chick right here that know how to speak Spanish? First of all, I'm cute, number one. Let me just put it like that. I'm cute. And I say this to all my patients. Like last night, I said to my patient, I asked her, do you feel much better now? Like, how do you feel? She said, oh, doc, I feel great. And I told her, you know why? Because you have a cute doctor. Look at the nails, look at the hair. I mean, come on. Who wouldn't feel better after they see me, right? But I mean, we all laughed about it, but that's the best thing about being an emergency medicine doctor, that you can be yourself. And I have fun with my patients. Even the ones that get on my nerves, I still have fun with them. First of all, I'm from the hood, and I work in the hood. So it's easier for me to be able to treat people, to deal with them, to interact with them much more easily. And to be honest with you, each person that comes into the emergency room actually remind me of my own family members. They're not that much different for what my family is going through. Whether the drugs, whether it's them getting shot, whether it's someone getting raped, whether it's someone homeless, or just suffering from depression. So what makes me think that I'm any different from them? I'm just a degree away. That's all it is what separates me from them is just that I have a degree in medicine, a doctorate in medicine, and I'm able to treat them. It's pretty much a tale of myself making home visits to different spots, answering people questions that they feel uncomfortable talking to or asking their doctor, or feel uncomfortable just talking with anybody, period. I realize that everywhere I go, whether it be at a funeral, to the wedding, to the store, anywhere I go, a lot of people always ask me questions regarding their health. Some of the questions are a little bizarre, but that's okay. No question is stupid, and I feel very comfortable answering their questions. And I think also oftentimes patients are afraid or don't know what questions to ask. And so this is where the show comes in to bridge that gap and also to have fun and to inform and entertain and educate people as well. People are actually quite surprised when they meet me in the emergency department. They don't expect to see a black physician, to be honest with you, even within my own community. And I think that's pretty sad. And so I hope that it inspired a lot of young people as well to look beyond their community, look beyond their current situation. Use me as an example. Like, man, she went through this. She's gone through this. She experienced this. And look where she's at. She's a physician. She's an emergency medicine doctor. I feel like when people hear my story, they're going to be inspired to do anything that they put their mind to. It doesn't have to be a doctor. Don't have to be a lawyer. Just whatever your passion is. I believe in people's passion. If you got something that is burning inside of you, and I'm not talking about an STD. I'm not talking about that. I'm talking about like your passion, okay? Let's get that straight. If you have your passion that's burning inside of you, and this is something that you want to do and you always wanted to do it, I just want you to utilize me as an example. My story is here to serve you so that you can go above and beyond what you think you're capable of doing. That's about it. If you have a question, you can tweet me or find me on Facebook or follow me on Instagram at Dr. Arabia Mollette. 2 L's, 2 T's, and 2 E's. Don't get it twisted. I always do that at the end. I do that at the end with my last name. I love my last name.